Hey guys, and welcome back to XO Medical Spa. And for giving it a like and for giving it a subscription, here's a picture of Kybella for you. It's the holiday seasons, it's turkey time, it's Christmas time, we're all feasting, we're all putting on the extra pounds until New Year's resolution. But what if I gave you the opportunity to reduce some fat in a couple problem areas, even though you're feasting, even though you're celebrating with family, even though you're eating a lot and potentially gaining some weight? So let's talk about fat destruction when we get back. There's two typical ways that you can get rid of fat. One is surgical, lipo, a couple other ways with that as well. Or you can do non-surgical, which is Kybella, skull sculpting, sculpture, and I think there's a couple other types where I won't discuss in this episode. But today we're going to discuss Kybella specifically. Kybella is deoxycholic acid, which is a bile acid, which occurs a little bit in our body, not exactly, but I'll talk about the pathophysiology behind it, and then how Kybella can be used to permanently destroy fat into certain problem areas. When we eat fat, when we ingest food into our body, it goes to our mouth, down our stomach, through our intestines, small intestines, large intestines, and then of course, the end product of it. But within that system, there's certain chemicals in our bodies that are injected into our intestinal system that helps break down fats. Fats by itself just doesn't go through our body. It has to be broken down somehow. So now we took that and we took that bile acid and we made it into deoxycholic acid, which is Kybella. And Kybella in and itself helps destroy fat, break down fat, much like our body breaks down fat. But what we do is we take that medication and we inject it into certain points of our body. Typically it's in the submentum area, that's the on label. Now we can take it off label and inject it to other problem areas as well. But what are some of the problem areas? What are the likely uses of it on how we can improve the way we look and how it can be helping along in conjunction with Botox, fillers, and even PDO threads? If we talk about our exodynamic lift system, what did we talk about the last episode? We talked about treating the entirety of the face. We talked about Botox, fillers, and threads to help uplift, contour, and slim the face. How does Kybella work into this? If we look at the stereotypical female Asian face, which I treat a lot of Asian faces here, it's very round. Now to achieve that very contoured face, how do we go from a round face to a more slim contoured face? We've talked about fillers to volumize, to contour. We've talked about Botox to slim the lower face. Now one of the problem areas is this buccal area. If you have this buccal fat, it keeps you looking young. However, it doesn't give you that contour because what it's doing is it's rounding out your lower face. So what can we do? You can either get buccal fat surgery, which would go on the inside of your mouth, take out some of the fat, and then remove it permanently. Now we can take Kybella, and if you have this buccal fat, or even if you have this jowling area, which we've talked about jowls repeatedly, and click on the card in descriptions in regards to jowls, lower face, and jawline structure, the jowls is the result of a couple different things. But let's assume there's a little bit of fat here that we want to get rid of. Buccal fat, we can't just diet and get rid of it. We have to destroy it somehow. So we can take Kybella and inject it into this buccal fat area to help reduce it non-surgically. If this jowl is pocketing a little bit of fat, we can take Kybella and shoot it into this area. And this will do two things. One, it will do the jawline slimming portion of it, or the lower face slimming of it, of our exodynamic lift system. We got to slim this lower face before we ever lift anything. And the second part is we can help destroy the fat in this area as well. If you remember me speaking about what are the differences between surgery and a med spa, is surgery typically can take away, meaning it can take away a bump, it can take away fat, it can take away volume. Whereas medical spa setting, we can't really take away. This is one of the few exceptions. Kybella can help permanently take away fat. Why can I say permanent? Yes and no, it's permanent. Will I take away the fat there? Yes. Will I take away the fat cells there? Yes. But whatever is left over, if you ever decide to gain weight again, whatever fat cells you have left over can always grow in size. It will be that much harder for you to grow fat into the areas that we take away, but there always is that probability. Now the other portion, or the other place that we can do Kybella, is commonly right here in the submental chin area, upper neck area, because if we have this fat area, again, it rounds us off. It takes away our jawline. In females, it puts weight on the lower face, which we talked about in female. We want weight in the upper face. For a male, if we're rounded here, it takes away our strong, defined jawline. So before we ever try to define it with fillers, define it with Botox, but define it with threads, because if I have this fat pad that's sitting here, no matter how much thread lifting I do in this area, it will just tighten up around the fat pad and you will still see this bulge. So we can take Kybella, and during Thanksgiving, we call it the turkey neck region. We can inject Kybella into here and remove that fat. Now, how is the process done and what are the expectations down the line? Kybella, you're paying for a little individual vials. Depending on the size of the area we treat and depending on how many sessions we do, will determine how many vials that we use. And this is where your provider comes in, because your provider has to determine what is the treatable area. Kybella comes in a template, and here's a picture of the Kybella template where we can apply it to this bottom area. However, the way I practice is I want to get rid of the fat safely. What if the template doesn't fit you and we have to treat outside that perimeter? The template doesn't fit into this buccal fat jowl area. How do we treat it? Just with years of experience and years of injecting clients, how do we safely treat it, but also give you the aesthetic outcome that you're giving for? So here, our fat doesn't just sit here. It melds into the lateral portion, the sides of our face. So when I draw on you, or granted, I don't even draw on you because I can visualize where I want to treat and how much volume I want to put into this area. And by volume, I'm not trying to put in volume, but how much medication I put into this area. Most of our fat pad resides right in the middle. So I'm going to put a larger proportion of medication of Kybella into this area because I want to destroy as much fat as possible. Out in the periphery, our tissue is a little bit different. Distally, our tissue is a little bit different and we don't have enough fat, or don't have as much fat as we do centrally. So I'm going to taper the medication to you, and I want to taper their medication to the amount of fat that I see in that area as well. For the average patient, it could be anywhere from 2 to 4 vials each sitting. So you come to me, let's just assume we did the treatment today, 2 to 4 vials into this area. We may do another vial here depending on your buccal fat and your jowl as well. You'll leave it alone, and what will happen is for about 2 to 4 weeks, you may see a little bullfrogginess, because once we destroy the fat, it's ruptured outside of its shell, outside of its cell, and it just sits there jiggling. And what it does is your body will take time, anywhere from 2 to 4 weeks, to expel all that dead waste, and then also 2 to 4 weeks for your skin to contract back up. What I tell clients is you visually, because you know yourself, you may notice it for a longer period of time. Someone who doesn't notice you may say, hey, what's going on with your neck down there, for like a week or two, but you will notice it for a little bit longer because you're more cognizant of the way you look. You do it once, come back to me in about 4 to 6 weeks. We do it again. Now we tailor it to you. Will it be 2 vials? Will it be 4 vials? Maybe even less, maybe a little bit more, depending on what we see. And then typically you come in for a third session again, 4 to 6 weeks after that. After that third session, I'm really gonna take a look at it and whether you need it or not. Once we've eliminated as much fat as we can in those areas that bother you, now we can talk about continuing the exodynamic lift system. Do we lift? Do we contour? Do we slim? Or is it a combination of all three? Now that we've eliminated the fat, we've eliminated the issue, we've eliminated the cause. Remember, we don't treat the symptoms here at Exo, we treat the causes. The causes of rounding off the lower face is those little fat pockets. When we've taken that out, now we continue with the rest of the plan. Botox, fillers, PDO threads. I hope that helps you guys calm a little bit fears when it comes to fat destruction, Kybella, cool sculpture, because around the holiday seasons, we don't care what we eat. We're just enjoying our times. We're enjoying our family. We're enjoying the great meals and the friendships and the families that we're able to surround ourselves with. Come New Year's, this is what we're worried about. A New Year's resolution with the gym, New Year's resolution of looking better. But now we have a way to help reduce that turkey neck, reduce the jowls, reduce the buccal fat without having to go to surgery. So make sure you subscribe, make sure you like it again. And if you like this information, make sure you reach out to us and come see us in office or schedule a Zoom consultation. We can talk about Kybella and how we can contour and reduce the fat in certain places of your face and even the body. We didn't talk about body this time. We'll talk about body next time, but schedule that consultation with us. Happy holidays. I'll see you guys soon.